Coming to you live from the CornerStone studios here at CornerStone Chiropractic in Minot. It's your Cornerstone in Health, Facebook Live.
Yes.
And we got both doctors here today, a whole team to present to you. Today we have a really cool topic, and we actually have our resident expert here to explain a little bit more about it. And we're going to explain what's happening here, but we're going to introduce a new technology to CornerStone, which we think is going to have tremendous benefits for our patients, for their results, and improve the healing of our community, and it's really exciting. You want to tell us a little more about that, Dr. Feelhaber?
Yes, absolutely. So on the resident expert part, that might be a bit. We've been working on this together for a while. The new technology Dr. Matt mentioned that we're going to be bringing here to Cornerstone and to our community is these hyperbaric chambers of helping your body generate, having the ability to increase the oxygenation for your body. And you've heard about these compression or decompression chambers. You get in there and the pressure increases and it pushes more oxygen into your body. You've heard about those, I'm sure. But I wanted to back up just a little bit about one of the things that we've done here at Cornerstone. And what's so exciting about hyperbaric chambers here is maybe the next step is we've brought in some technologies over the years. And even as I talk about hyperbaric chambers and having it be a reality, with me going to training here in New Jersey for certification with the Undersea Medicine Board over there this week, it's almost like, wow, we're at that point now where I wouldn't have thought of us being there. But we've brought in technologies that match up with natural healing and boosting the body's ability to care for itself from the inside out. And so Dr. Matt was the one of in our practice that first came across SoftWave, our stem cell tissue regenerative therapy that we do, and brought that to the practice and our attention, and it's just been fantastic for helping people heal, right?
Yep.
I mean, it's been amazing. And then, the next step of technology that we introduced here earlier this year was Invisaret technology for helping people detoxify their bodies, lose fat, body fat percentages, losing weight, shrinking skin, increasing their body's metabolisms, and all those positive things. So
lowering blood glucose, and lots of cool stuff there.
Yeah, fantastic benefits. So now as we talk about hyperbaric chambers here, it's spectacular. And so, really the whole gist of what we do in our practice is, helping people reduce their levels of inflammation, toxicity, and stress. And chiropractic adjustments and releasing nervous system tension allows the body to deal with those three things.
Absolutely.
Yeah, and I know I would say that you're the resident expert here in our nutritional part of our practice too, of nutrients that we're deficient in or we need more support in.
That's a big part too, and thank you for that. I guess we're throwing that term around pretty loosely, but I'm just thinking about how exciting it is with all that you mentioned. A lot of the other technology we've added, but I'm thinking when we have the back on track decompression chairs, and we have SoftWave, and we have very high level scientific based chiropractic adjustments. Adding in the hyperbaric, we can start to do some really cool things with people that don't respond to care very well. People that are struggling with disc issues. Even non-surgical disc repair is something we're going to be able to accomplish here in this clinic with all this technology. And people with neuropathy or things that just don't respond well to typical traditional conservative care, or even to more advanced Western medicine, we'll be able to get relief. So not only you'll be able to do it in a natural way, you'll be able to do it in a very effective way, which is really cool. I'm super excited about it. I think the more, like Dr. Feelhaber said, we were both kind of looking into it. Now I will say that Dr. Feelhaber has already taken the due diligence. Nothing has made it necessary for us to do this. There's no requirement to do that, but Dr. Feelhaber has already taken the due diligence to become a certified safety director on hyperbaric chambers. So just another level of confidence you can have once we do have this technology in the office that is being delivered in the safest way possible. Well, researching it, the more I researched it, the more fascinated I was about it. And there's really nothing that doesn't benefit in your body from increased oxygen.
Right, exactly. When you think about it, there's three things we need. There's to be alive, we need food, we need water, and we need oxygen. And we can live without food for a while, quite a while. We can live without water for days, a number of days. But you can't live without oxygen. And I mean, you need it
you got 3 minutes max.
Exactly. And so, when you really think about this concept of, well, how am I going to increase my oxygenation? So even if you believe that, yes, if I would boost my oxygen levels in my body, I would be healthier. That's a given if you believe that. You know, we do the pulse ox measures, and that's all in medicine. You know, that should be between 96 and 100%. So if you're at 100% or within 4% of maximum, the question is how do I get more oxygen into my body? And you can't do it by hyperventilating, taking more, breathing it in. It's just impossible. One of the ways that people have maybe heard about, boosting the body's ability to absorb more oxygen is doing that high altitude training, where someone goes up to say Denver and they train in Denver, and your red blood cells change and they or have more capacity to support and carry more oxygen through your body. So then when you come down to a lower elevation, then all of a sudden your body has more oxygen. Right. That's super temporary because the body's efficient. It doesn't want to have to do that if it doesn't need to. But what's amazing about that is about with this hyperbaric is that this is the only way for you to boost your body's ability to get oxygen in that's possible without doing some type of training like that, going up there. And so you can do it right here. And the way that happens is that when you're in a pressurized chamber, very comfortable chamber that's pressurized with oxygen at a certain level, it's almost like taking a dive. They reference it that.
The pressure pushing down.
Yeah, the pressure coming in. So there's equalization procedures that we go through with our patients and training that goes into involved in making it sure that it's comfortable and safe the entire time. But when you go into that pressurized environment where the oxygen level is boosted up, that pressure on the inside of the chamber is greater than the pressure inside your body. So it helps that and makes that possible for that oxygen to get into your body.
Into the tissues.
Into the tissues, right. And even though the pulse ox says 96%, that is not, or 98%, that's not through every part of your body.
Yes, that's in your blood, right?
Yeah, exactly. So you've got joints that have microcirculation issues. You've got maybe parts of your brain. People with dementia are benefiting massively from hyperbaric care. You've got different parts of your body that don't get even what you think you have. And so that's what's so exciting about doing these sessions is that it moves it beyond 100%, right? And it gets into these areas of your body that you couldn't get it into otherwise.
Yeah,
that's unreal.
Really cool. It's really interesting for me to find out in researching it too, because I just assumed, you've seen the hyperbaric chambers before. You just assume they just fill this thing with oxygen. You're just breathing in more oxygen. That's not what it is. It's actually increasing the pressure.
Right.
And then, we're going to do some research. And Dr. Fielauber, actually, we should mention this. He's going to a hyperbaric conference, actually, the end of this week. Actually, tomorrow.
This week,
in New Jersey, where we're going to do some research on what the best chamber to get for our clinic is, because like Dr. Fielauber was mentioning, it's the pressure that actually drives that oxygen into the cells. And there's different amounts of pressure that we can use in different chambers. And so if you, for example, use a 1 atmosphere chamber, you would need twice as long to get the same doses if you used a 2 atmosphere chamber, right? So if you used a 1 atmosphere chamber, you'd need 2 hours to get what you would get, the benefit you would get from 1 hour in a 2 atmosphere chamber. So that's pretty cool stuff. You want to tell us a little bit about the conference?
Sure, absolutely. So the conference is very much hands-on with a variety of professionals. I know that there's going to be a PhD that's a huge expert on underwater pressure and hyperbarics across the board. They have a certification board that certifies hyperbaric clinics across the country. He's going to be one of the presenters there. And then one of the other docs that's the lead presenter there has had a hyperbaric chamber for 15 years out in New Jersey, and is going to be going through all the procedures and so forth. So it's a lot of hands-on work. It's a variety of professionals that are there, from medical doctors to chiropractors to other clinic directors and so forth. And so we'll be going through the science part of it, the application part of this, and what I'm really excited about expanding is the understanding of what is it actually going to take, because we've all heard, and you've probably heard, oh, my buddy has one of those, or I've heard about that, and a kid gets this, and they go over and sit in it for an hour, and it's treated very casually, I believe. And I just had one of the family members say, yeah, one of my family has a chamber and goes over there. And I think that's all right. It's kind of a testament to the safety and how effective it is, and people are trying to do that. But what I'm excited about is having the level of understanding, like we do everything at Cornerstone here, to the next multiple levels, where this condition generally this condition responds very well over a period of 10 sessions or a period of 20 sessions. And how frequent should those sessions be?
It's
How far apart should they be? What pressure? Because Dr. Matt and I have evaluated that, and he alluded to that, of the different intensity of pressure. Some conditions respond really well to 2 atmospheric pressure. Some respond well to 1.3, at different treatments. And so what and the specifics of how to apply that for our patients, so that when they come here, it isn't just purchasing a service from us, but we're actually providing a history of knowledge and understanding of what is this actually going to be, the professional application of that, so they can have confidence in the fact that they're investing in this, because this isn't cheap stuff, right?
No, it's not.
Insurance doesn't cover this type of stuff. And so people are going to be spending their money on this in an effort to regenerate their bodies. And so the way that we've done this is said, okay, if we're doing this, we're doing it the right way. We're going to bring in the very best equipment. We're going to bring in the best protocols. We're going to make sure that this matches up with all that we're doing, and so that we can measure progress with this.
Absolutely.
And that's what's so exciting about the training. I mean, I guess it's just an expansion of what we're doing.
Exactly. So. And I should say I was planning on going to this conference too, but we have a family trip that got in the way. But you took the words out of my mouth. I think there are so many doctors that see stuff to get excited about and be like, this is cool, you should try it, this is cool, you should try it, versus, hey, we got this, we know specifically what we need to give you in terms of using this in order for you to reach the goals that you want to reach. And so that's going to be very cool.
Yeah, absolutely.
And there's been some really cool, exciting studies on its effects on anti-aging, to work with concussions, wound healing, immune system. It's just really cool what these things can do. Yeah,
and we probably didn't even talk about that very much, the different conditions, because there's lots of, like you say, studies on traumatic brain injuries. Vascular dementias is a very one that responds super well. Certainly, carbon monoxide poisoning. Those are kind of the big ones. But what they're finding is that there isn't anything that our body doesn't do better with more oxygen.
No.
Right?
Exactly.
If you have less oxygen, when that pulse oxygen goes down, that's below 90, whatever, it's trouble. Thinking starts becoming an issue, and everything becomes an issue. So when you're thinking about would this benefit from, hyperbaric care, well, is there any system in the body that doesn't perform better with more oxygen?
No.
There really isn't. And that's one of the exciting parts about this, is there's different physiologic pathways that match up with, that make sense about, say, this improves generally because of this, and this. And that's the training and the extra stuff that we're bringing with this. And so when someone says, is it helping with autism? Is it helping with focus? Is it helping with, my anger, anxiety issues, or depression? I mean, there's lots of different things. Well, the pathways for that are different for each thing, but as the overall improvement of the our bodies and the body itself improves, all those other things become easier. And so that's what's just tremendously exciting about bringing it in.
It's a lot like, that it fits a lot with our philosophy on chiropractic, is that chiropractic, having your nervous system working better helps every condition in your body. It helps the whole system, right?
Yes.
And so this is just an extra. Now when we have your nervous system working well through your chiropractic care here, you'll also be able to get, the good stuff into where it needs to go, so speed, recovery happens faster, healing happens faster. I'm really excited.
Yeah, and one of the things that we see that we want to bring in is that we don't want to bring anything in. We've always done this. It is a splash in the pan, right? Where it's just going to be like, oh, it's going to be really cool for a bit and then it's gone. This is almost like one of the ways you can think about oxygen is clearly we need it all the time, right? I mean,
I think I'm good on oxygen.
Yeah,
I was breathing all day yesterday.
That's enough for the week.
I'm gonna take a day off.
Take a day off. No, you need it. So it's like a nutrient, right? So you need that. And one of the interesting parts about when you think about nutrients, for example, like with vitamin C, there's a minimum amount that you can get by with, right? And if you go below that, you can get a condition over time, scurvy. We've heard about that in the past. And so they never hear about it now because it's minimum there. But there's a minimum amount you can get by with, right? Which is a lot of times a minimum amount of oxygen people get by with. Then there's periods of time where you need more of that oxygen. Say, for example, the vitamin C, you got a cold or flu, you bump that vitamin C up because it boosts your immune system response. And oxygen is very similar. Like when there's an injury or an illness or something that someone needs a boost from, they need that boost, right? And how long do they need that boost? Well, how intense is that that nutrient need.
Yeah,
right?
that's a really good point. Really fascinating. I was listening to some stuff about competitors, and this goes to your point, who are in organizations where they can't use additional like testosterone.
Performance enhancing drugs.
Exactly.
Yeah.
And they said it's just like super easy to cheat that test because you do your cycle of steroids, and then before the test is taken, you stay up all night and have a lot of alcohol, and then the next morning your testosterone is tanked.
Oh, sure.
Because your body needs to use all that testosterone to take the abuse. So like you're saying, if you've got a condition or something, your body needs more of that.
Yes.
Yeah. So you need a baseline, and then there's certain points where you need more.
Right.
Yeah.
And we see that we know there's going to be people that need more intense for shorter periods of time. And then there's going to be people that need just a little bit for a period of time. And then there's going to be, like this is going to be for myself, I know this is going to become part of my wellness regimen, right? For the long term, on a regular basis. Now, what is that frequency? I haven't figured that out quite yet. That's the process of what we're coming to. But that's what I'm excited about for our patients. I know we're going to have a lot of patients that are going to want to just do this as a regular part of their wellness care. Like you exercise, like it's like taking care of your system, boosting all of your overall wellness by far. Where else do you get anything like that?
Exactly.
I mean, that's amazing. So, start to finish, I'm super excited about it.
I'm excited for it too. Usually, I know that like in the winter time, the first time I see a sign of a sniffle or something, I'm going to be jumping in that chamber.
Extra boost.
Exactly.
Right? There you go.
I'm going to be getting adjusted and jumping in that chamber.
Yeah.
So, I guess we should tell people when we're kind of thinking ballpark we're going to have this in the practice.
Yeah, I would say this weekend, Dr. Matt and I have talked about when I'm at the training, I wanted to talk with a number of practitioners that had a variety of the equipment that we've looked at. And so that we can zero in on the specific equipment that's going to be right for us. I believe, we're ready to purchase that equipment and bring that in when we've zeroed it in. And I would anticipate that we'll make that decision maybe next week after I'm back and talk about it and go through that. And I would anticipate shipping, so far we would anticipate probably within a couple of weeks shipping. And realistically, I would think around September 20th or 25th or something like that, roughly maybe, would be a time that we're looking at. We're going to let you know. We'll certainly have more announcements about that. We'll talk about maybe on one of our lives here again. And people are going to have questions about pricing, this type of stuff. We're going to get all that stuff out for you, just like we always do. Just make it simple, make it affordable, make it easy for you to get in and give a shot and try it out and see if it's right for you. And so that's a rough time, maybe a month or so, 4 to 6 weeks from now, to be able to actually actively start doing these treatments and experiencing those benefits and really boosting the health of our community.
I couldn't be more excited to get this technology going and start offering it to patients. It's going to be a great benefit and so much fun to be able to have.
Yeah, like I said earlier, it's almost. Really, hyperbaric chambers, you're going to have that in your practice? 2 or 3 years ago, it probably would have not been on the radar. But what we've built and together and what we've brought and, what our patients have been asking for, the demands of our patients, really, I've had many patients ask us about this. When are you going to do this? When are you going to do this? And so I, applaud you guys out there for pushing us to actually bring more to the table for regeneration.
And we want this to be, Dr. Philip and I have always had a goal, this is your wellness place, right? This is your wellness stop. If your arm is broken or there's blood shooting out of something, go to the ER. But to take care of yourself and get yourself healthier, we want all the stuff available here. And that's another, reason why we're willing to invest not only the time in learning about it and implementing it, but also the money into buying it because they're not cheap either. So. So. Awesome. Well, we'll bring you more information after we're back. Heads up, coming up here in the next 6 weeks, we're always going to keep adding new things to boost your wellness and have your life be better. So thanks for watching. Thanks for listening. Thank you, guys.
All right. Cheers.